Start the recording. Okay, well, welcome everybody. Happy Wednesday afternoon. I hope you're doing great. It's a beautiful day outside. If you haven't had the chance yet, I hope you're able to go outside in a safe distancing kind of way and enjoy the fresh air and get a little vitamin D. It'll be great, I'm sure, for your soul and for your well-being, which is what we're here today to talk about is mental health and mental wellness. As everybody knows, the Chamber has been doing its utmost to try to connect people with financial resources or to encourage people to shop local and different things you can do to support our local businesses. But some of those local businesses are two of the ladies that I have online with us today, and I'm real excited to have Kelly Lashar and Lynda Cerveny with me today to talk about mental health. And so ladies, if you wouldn't mind, Kelly, you go first, introduce yourself and say who you're with, and then Lynda, you can chime in after that.
Okay, I'm Kelly Lashar, and I am with Restore Behavioral Health here in Norman. We are a team that we have 13 licensed therapists, some social workers, and have different roles. I'm a licensed professional counselor candidate currently. I have served in the past as a pastoral care therapist, so counselor. So I see a lot of college students, adolescents, couples, things like that. Our practice is seeing children. We've gone exclusively to telemental health. So Scott, as you say, you sit all day on Zoom. I sit all day like this doing therapy on a computer, but it's been very effective. So I'm with Restore, and it's a private therapy practice in town.
Very good. Lynda, tell us about yourself.
Yes, my name is Lynda Cerveny. I'm a master level psychologist, and I've been working in the field for many, many years. I work mainly with adults and also with teens, and have been associated with Norman Counseling Clinic for many years. But at this point in time, I'm working by myself, but am working with a lot of people in dealing with this current issue.
Mm-hmm.
Very good. And I want to tell everybody that is tuning in or that might tune in as we're live on Facebook right now, I'll be monitoring the questions. So if you happen to have a question for Kelly or Lynda, please certainly feel free to write a comment, and I'll do my best to relay those in the midst of our conversation. Okay, so let's jump into it. You know, as I mentioned, the Chamber, we've been doing a lot of work trying to connect people financially and ensure that businesses are staying afloat and accessing federal dollars or doing what we can to help promote shopping local. But in the midst of what seems to be an unlimited number of Zoom meetings these days, at least for myself, I hear a lot of conversations about people struggling, either with the idea of more isolation. You know, people are trying to follow the rules and shelter at home, stay at home, or they're faced with possibly unfamiliar scenario, like with having their children at home all day long and what that looks like for them and the stresses that go along with that they're just not quite used to. Or even, you know, the fact that your spouse who you love dearly, maybe you're not used to being around them as often as you're having to be around them these days. And so what are some of the conversations you're having, and maybe even some of the advice that you might give to people?
There's a lot of just general anxiety, fear of the unknown, dealing with all this uncertainty. We don't know how long this will last, but this is just a temporary situation, and hopefully before too long we'll be returning to normal. But this can take a toll on people and be very draining on them and result in depression and anxiety. They're dealing with this isolation, as you had referred to, and not being able then to spend time with family and friends as maybe they wish to. They may even have, financial issues, job loss, in addition to that.
One thing that I found unique about this is we're all in the same boat for the most part as a world even, but everyone's issues are different. You know, you might be in a house with a second grader that has trouble learning, and then also with your spouse, with a college senior who's worried about where are they going to go in 2 months, you know, what is their plan for the future. So the concerns are very multifaceted. Even in a same person, they may be worried about they're withdrawing, they're missing their community, but they're also not sure about their finances. They're afraid of whatever. So that's one thing that I've noticed. The whole world is going through this together, but we're all experiencing it in a different way. Even in a day, I might experience 4 or 5 different emotions and concerns related to this. They're very real, and there's really no right or wrong way to be feeling right now.
You know, I shared with you before we went live. I'm on a lot of Zoom meetings every day, and today was a particularly busy one, and still, I think I have another one after this. But I spent a few of those meetings on the back porch. I just needed to get a little fresh air, some sun, and get outside of the 4 walls of the house. Are there things, or maybe I say tricks, but recommendations that you might share with people to where maybe they're not thinking of relief, things they might be able to do, but do you have any insight that you might want to provide?
One thing I've noticed is, at the end of the day, humanity, the thing we all have in common is that we're human and we're built for connection. And it's really interesting to see all the creative ways people have started connecting. Even teenagers, I don't know when the last time I heard a teenager ask to do a video session with their grandma, right? But they're seeking those connections. And I think that's going to end up being a real benefit from this time, that we've gone out of our way to make sure we're still talking to people and not being alone. A lot of people are really seeking ways to do that, even if it's, playing words with friends with someone or texting more back and forth. I'm not really ever seeing that attempt at connection quite as creative as before. But like Lynda said, the ones that are depressed and have a tendency to already kind of withdraw when they're feeling down, they're ones that are going to have a more difficult time actually intentionally seeking communication, which can make it worse for them.
Lynda, do you think that intentionality is really important right now, that you do have to be intentional about that human connection and, going out of your way to seek that if it's not automatically happening? And to be fair, I don't know what it would be like if I were single and stuck at home by myself, because even having a great conversation like this is awesome, but just to be able to hug my kids, kiss my wife, I really treasure that, and so it helps me get through my day. But Lynda, do you think there's some intentionality behind it?
Oh, most definitely. The staying connected is so important, and with family and friends, and trying new ways of doing this. Trying to play games online together, or maybe pursue a hobby, something you've never done before, and it would be something different. So along those lines, but the daily routine, the structure is important. So something that will motivate you to, kind of be productive, but again, don't overwhelm yourself if you're not overly productive. You can only do what you can. But anything you can do to even try to help others, just making phone calls or checking in on others, maybe some elderly individuals that you even know in the neighborhood, just to call and check on them. You mentioned getting outside, and that is so important. If we can go for a walk, they are saying that nature is so important to us now. For if you're feeling some depression or anxiety, either one, that being out and experiencing nature, it's just very centering for us and very welcoming. So staying with that, eating right, sleeping well, just keeping that structure and routine.
Mm-hmm. Yeah, that routine really is important. Even as basic as get up and get ready, right? Because it's really easy to fall into the rut of we're all in our pajamas until noon if we're able to, CNN or Fox is on the TV all the time. I say, get up, get some shoes on, brush your hair, act as if you're going somewhere, and then sit down at a dedicated space for your job or for school and have some regular structure that seems normal, a little bit more normal than just being comfortable and lingering all day long in your home.
Yeah, Kelly, you bring up the news. I have some friends and family members who seem to get sucked in by particularly national news. And let's face it, you turn it on today, there's not much else they're talking about except COVID-19, the pandemic, and the crisis, the global crisis. So, and I've tried to tell them, look, get caught up, but then turn it off. But what kind of recommendations would you give in that respect? Because I know people want to stay informed, but I assume there's only so much of that we can really handle in a day.
One thing I really notice is being mindful about your children at home and how much the TV is on within their earshot. They can't handle a lot of the images and things that are being professed on the news. I would say turning it off, turning it on to check what's going on, or reading a feed real quick and then turning it off. Asking your children if they have any questions, because their thoughts and their questions and concerns are not the same as the adults' questions and concerns. I talked to someone the other day that said they were really worried about paying for college because of all the news about, the stock market dropping and watching their own jobs go away. And they said something out loud to their child about that, which that's an adult problem, right? I mean, the child isn't needing to carry the weight of, can my parents pay for my college? So it's difficult to discern, but to be really mindful of what is adult information that we are capable of processing and what is supposed to be sheltered from the children. I think that's going to be really important.
Yeah. Do either of you have any recommendations on that front on young people, kids and children, in Norman in particular? And we all know that school, in-person school or in-class school has been canceled for the remainder part of this school year. I think it will go until school will now go until May the 12th. So it's even at that, it's going to be truncated. So our children are finding themselves in a new world. But any particular advice that parents could implement on behalf of their children during this time?
Lynda, do you want to answer?
Sure. I agree with Kelly, trying to avoid some of the news, not having it all on time. We want to be informed, but not be overwhelmed with that. So, maybe you want to try to minimize fears, so you can give them some information, and depending on their age group, what you can tell them. But encourage the kids, again, to go outside and to do creative things, whether it's painting or just simple, fun things that they have never done before. Pursue those sort of things and use their imagination. That today there's so much of the being entertained with the video games and such. And so if you can get them away from that and just play some board games or something along that line, that's very healthy.
Yeah, and I think to remember that they're at different developmental time zones than we are, obviously. And so their fears and their thoughts of processing are not at all the same as ours. So actually to say, is there anything that you would like to ask a question about related to this? What have you been thinking? It's surprising how sometimes children, because they are so egocentrical, that's part of their development, is to be egocentric for a long time, right? They could interpret it sometime as, well, is this happening because of me? Did I do something wrong? Or is my dad irritated right now because I'm bad? When really he's stressed because he just watched his retirement drop 50%, right? So I think actually asking the child, what are you feeling and what questions do you have, instead of assuming that we know because they feel like we do, because they're experiencing this in a lot different way than we are.
So what about coworkers? So we at the chamber, we have a weekly staff meeting, and that's pretty religious on Mondays, typically is when that happens. And so as we've transitioned to working remotely, we've gone ahead and kept that meeting time. And so we're having our staff meetings via Zoom. which are going well, but do you have any thoughts on how businesses, coworkers can still stay connected, or what we can do to help get us through this time?
I think maybe some additional time, not just not just strict business, but actually to connect and spend some time together like you had previously, whatever kind of relationship you had, whether it's, through text or email. A lot of emails can be very cut and dried and maybe more business oriented, but to text or call and keep that contact with people, I think that's very important because we do feel so isolated working alone, even though we have some contact with people during the week. It's not like we walk by their office and say hello and chat or go have lunch with them. And so just any attempt to reach out and connect with other people and not to decrease that feeling of isolation.
We had an experience, most offices have a birthday list up on the wall so everyone knows when people's birthdays are. Well, we almost missed one this week because we're not in the office. So I would say, don't miss your coworkers' birthdays. Like, make sure you know when those are. If someone's coming up, message them. And I think people want to know they're thought about, not just because they work together, but because they're humans that we enjoy being with. And so make sure that they still have that connection.
We had a staff birthday during this time, and usually we do a staff lunch for birthdays, so we haven't had the chance to do that, and we'll hopefully pick that back up when we all get back together in normal case. And then we can't grab coffee in the kitchen, every morning like we always do, and just kind of catch up. And so it's been fascinating in that respect. So
as far as coworkers, I'll mention this. So I've actually had a couple of business people reach out to me in the last week trying to decide what they can do to help their employees, recognizing that as a leader of their team, they do have people that are hurting, whether it's because of their financial needs or they are single moms, or they're experiencing maybe even the death of a loved one because of this. And so they are actually starting the conversation of how can we help our people with their mental health needs, and maybe even setting it up where a therapist can Zoom with one of their employees or sit at the end of a long conference table, at the bank and sit with one of their employees like that. So I would encourage employers to actually ask a therapist they may know, or call a place, or call Restore or Lynda, and ask if that's even something that they would be willing to help offer during this time.
Yeah, and I want to encourage people to go to our website, the Chamber's website, normanchamber.com, and we have a great resource list of Chamber members who provide these kinds of services. And you can click on the member directory, and you can pull up that particular industry, and you can find great people to assist you. And we actually have a question that kind of dovetails, I think, into that. So Bonnie, thanks for joining us and also providing this question. And so her question is, can you address the barriers that people face related to the stigma of seeking help for mental health / emotional needs?
That is something that we still struggle with. There are still those barriers and that stigma that exists, and I'm sorry that it still does, but that is part of people who are uncomfortable or really don't understand mental health, because all of us can, at some point in time in our life, benefit from therapy, and it does not mean that you're showing weakness. It's seeking assistance and empowering. That's what I do with my clients, is I try to empower them in whatever their need is. I want them to be the best that they can be in whatever issue that they're wanting to address in relationships or work, motivation. And so for people just to realize that it's okay to ask for help.
Mm-hmm. Yes, because we're humans, right? We have emotions and we have feelings. We all have experiences. Some are very traumatic. In the past, we've learned how to defend ourselves in certain ways, and we operate in the world in a way that really would help us if we were able to get some insight into that. And I think to recognize we're not just physical beings, you know, we don't just sweat and eat and walk. We also think and feel and fear and all of those things. And so if we can really start recognizing ourselves as whole beings and recognizing that therapy can really help develop that side of us, I think everyone would find such benefit in it, whether it's in regular therapy, like exercise class once a week, you go to therapy once a week, or if it's you go during a time of crisis. I think everyone will find a benefit in it if we can just not be afraid to do it. It's okay if you have to seek help. Everyone needs it sometimes.
Absolutely. And Bonnie, thanks again for that question. She left another comment, which I want to share. I think we'll have this in the notes later on, but just I'll put this out there that Transition House is doing wellness gatherings on Zoom. Their first one was today. And so if people are interested, please give Bonnie a shout at the Transition House and she can connect you with those resources.
Right. You know, Scott, one thing in relation to that, kind of the idea of technology, this telehealth and the stigma, we've actually noticed some people are finding it easier to do therapy this way because they're not having to go into a building. They're able to be in the comfort of their home. They maybe even have time now to put their mental health first because they have a little bit more free time. That's a benefit that we didn't really spot coming. We thought maybe the numbers would decline, but actually more people are calling because it feels a little safer, and we're talking about it a lot right now.
There does seem to be a healthy dialogue, or just people are more, seems to be more open to the conversation today than even a year ago or 2 years ago, which I think is great. Being in Norman, having Griffin Memorial Hospital here, it's certainly, I think, a little bit more prevalent on people's mind that mental illness is real, and and we need to properly address it, and whether it be mental illness or just mental health. I mean, these are real things that we all struggle with, and we need to, as opposed to just sweeping under the rug.
I don't want us to be mindful. It's hard because we work in private therapy clinics. We don't work in community mental health. And the discussions that I had, like the discussion I had this morning with a group, there are so many things going on. Many people don't have technology. They don't have internet. They can't do this. Some people are stuck in a home with parents that are abusive to them, or wives whose spouses are abusive. The situation is not the same for some people in our community as it is even for us, Scott, that you can sit on a desk with a computer and talk about problems that we have compared to some others in our community. So I would just ask everyone also to just be aware of that. You know, there's other issues going on that are related to safety and mental health that we may not be experiencing, but to be very mindful that our community is going through things like that. And it's a really very difficult time for some people, almost like they're on the edge of life and death right now. I know that sounds very dramatic, but I want us all as a society to be mindful of that too.
Yeah, real consequences to the world that we live in right now. I mean, that's important. So Kelly, you mentioned that you have transitioned to telehealth. Lynda, have you done the same thing for the time being? Are you interacting?
I'm working toward that. I have been doing phone therapy at this point, but I'm in the process of going into actually the video. Many of the insurances are allowing the phone therapy. So for those who do not have computers, do not have that technology, be sure for people to be aware that they can have therapy over the phone. And even if you don't have insurance, those of us who do offer self-pay rates for that also. And so, but as Kelly was mentioning earlier, that domestic violence is an issue, and substance abuse, there are, increases as there's more stress in the home. So want to let people know that there is help available. There is a 211 helpline from the state if there are needs to be addressed, and you can get some resources from that way. So please, yeah, reach out in whatever way you would, if it's through your insurance company or just calling a therapist and trying to schedule appointments we are available.
Mm-hmm. Yeah, I agree. That's been very helpful. A lot of different rules have been lifted during this time. So the insurance is covering it. The state boards are actually also allowing interns and candidates to do video health without being in the location of their supervisor, which is helpful because it allows some clinics to offer even free therapy by using their interns. So that's something that's helped. I think that the whole society is recognizing we need to make this as accessible and as easy for people to do as possible to remove all of those barriers.
Kelly, you mentioned earlier that I made this just because of where we're at, that maybe people might be a little bit more inclined, or some people at least, feel a certain degree of comfort, I guess, across the screen as opposed to in the same room. So I guess that's one silver lining to the place we find ourselves.
Of course, it's hard for people to find a place alone in a busy home when everyone's home. So just like you said, going outside under a tree, away from earshot of everybody. That's one thing too to note. When we do telehealth, it's completely confidential. Like I would normally have on my headphones and I make sure the client knows the room is empty, no one's here, no one can hear what you're saying, you're safe, you're confidential, even though you don't see me in the room, this room is secure, and asking them to do the same thing.
Very good. Okay, well, as we kind of come to the end of our time, any other closing thoughts you'd like to share with our audience today as they consider their own mental wellness right now?
I think just focus on the recovery, that this is temporary and the time will come to an end and we will return to our life that we once knew, and just focus on what we can control. And not worry about what is not in control, but, challenge those fears that we have and not allow those to overwhelm us.
Mm-hmm. That's good. And I think I've been telling people too, let's try to find a purpose in this period of time. We can look at it like this gigantic dash, right? Like pre-COVID, post-COVID. Now what's happening in this dash period of time, or like almost like a wilderness or a waiting period. I actually think if we use this time right, we can look back one day and say, during that time, that was really actually very meaningful. This happened with my relationships. I learned how to play the ukulele or whatever, like that it actually can have a purpose other than we're just writing this out till it ends. Let's make something positive out of this time and find your identity with yourself, find your family connections, make something good out of this time. It doesn't have to be just to hold on and wait.
Awesome. Well, those are both great closing thoughts and comments. And Lynda, Kelly, thank you so much for joining us today on this conversation. I would encourage people, again, if you have a need in this area, give either one of these ladies a call. You can find their contact information on our website. They would love to talk to you, whether it's today, tomorrow, or next year. They're there to assist. And as the Chamber considers how we can practice safe social distancing, but still meet the needs of our members, I wanted you to know that later this month, during our normal business after hours on the third Tuesday of the month, we're going to hold a virtual networking event. So look for more details on that. It'll be at 5 o'clock. We'll do it via Zoom, and so we'll send out the link. But it'll be another way for us just to connect and catch up with people. I know a lot of these calls I've been on, people have been like, oh, it's so good to see you, and just see a friendly face. And so the more we can do that, I think the better it is for everybody. But in the meantime, I hope everybody stays healthy, stays well, take care of yourself. Again, ladies, thank you so much, and we'll look forward to talking to everybody soon. Take care.
Thank you. Bye.
Thank you.